Hi, everyone. Welcome. My name is Rebecca Matthews, and I am the Residency Program Director here at Emory. And I will be joined later by Dr. Spencer Hutto, my APD. I wanted to tell you a little bit about the program today, and I'm going to start by telling you a little bit about me. As I said, I am Rebecca Matthews, and I have been the program director here at Emory. I started in the middle of interview season in 2015. So this is my seventh year, and this has really been the highlight of my career thus far. I love being the program director. I really see myself as the residence advocate. Since I took over, there have been a lot of changes to the program, and these changes have all been resident driven. I think really it's so important to listen. And that's something that when I first took over the program, I met with every single resident and I asked them what they like and what they don't like about the program, and then set about making changes. So all of the changes we've made, I think, have been positive, and we continue to do that today. We continue to communicate with the residents, see what's working, what's not, and make changes in order to improve their educational experience. I am an epileptologist. I am from upstate New York, from Buffalo, and I went to college there and went to med school in New York at Mount Sinai. And then I did my residency in Chicago at Rush, followed by a 2-year epilepsy fellowship at the NIH in Maryland, and stayed in the DC area for 5 years after that, and worked as a civilian epileptologist at Walter Reed, an Army hospital. And I've been here at Emory since 2014, and I totally love it. I love Atlanta. I'm divorced. I have 2 kids. They are 12 and 7. And for me personally, wellness is very important, work-life balance. And I'm a competitive adult figure skater. Unfortunately, last week I fell working on a jump and sustained a T12 compression fracture. I'm actually wearing a heated and massage belt that my residents got for me. So anyway, the whole point of that is that for me, it's really important to have a life outside of medicine. And you'll see, when you kind of hear Spencer and I talking about the program, that your well-being is very important to us. And that's kind of permeates through the program. And hopefully you see that when you talk to our residents. All right, let's talk a little bit about the program. And, you guys are going to be interviewing at tons of places and, hearing all these details about the call schedule and the rotations and electives. And I think, you're going to get great training no matter where you go. And, it's really important to find your family, find the people that you are going to like being around, because these are going to be people that you're spending day in and day out with. And these, you want to make sure that these are people that you feel comfortable with, that you feel like you have a home with. And so, don't underestimate your gut feeling. When I was looking at programs, I went to Rush. I really loved it when I went to interview, but it hadn't really been on my radar, and because I didn't know much about it. But when I went there, I just got this amazing feeling about it. I love the program director. I love the residents. They all seemed really happy, down to earth. I felt like I could fit in with them, and I was really happy that I went there. So, you guys can't come interview in person, but you are able to kind of see the interactions among the residents, and, hopefully looking on social media and kind of seeing what our program is like and the interactions between people, you can really pick up a lot from that. So, I'm going to tell you stuff about our program, but I think the important thing about the day is to really assess if this is a group of people that you feel like you could feel comfortable with, because that's very, very important. All right, so stuff about us. Emory is the #1 hospital in Georgia per U.S. News and World Report. We had over 500 million in grant funding last year, and we're ranked number 12 in the country in neurology for federal grant funding. We're a big research institution, obviously. What's really nice is that we are really the only academic center in town. That's very different from where I trained in Chicago, where there were 5 academic hospitals in one block. Well, not in one block. There were 3 in one block, but there were 5 in the city. And so there was a lot of competition for patients, but that is not the case here. Our goal here at Emory is to train you to be a well-rounded neurologist. And we are not looking for one type of person here. We just want people who have a passion. So your passion might be teaching, it might be community advocacy, it might be working with underserved, it might be research. It might be quality improvement. You might not know what you want to do yet, but that's fine because you're very young in your career. You're just starting. And the thing about coming to Emory is you're going to get exposure to everything and you're going to have an opportunity to foster your own individual interests. And that's what we want to do here. We want to allow you to follow your own interests and become the neurologist that you want to be. You're going to get great clinical training here. This is an amazing clinical program. You're going to see everything. You are going to really be able to leave here and go practice anywhere, but you're also going to have the opportunity here to foster your own individual interests. And I think that's a real strength of our program. We value diversity at Emory. If you look at the demographics of Atlanta, it's a very diverse city. It's 51% Black, 40% white, 4% Asian, 4% Hispanic Latino, and 1% are multiracial. So, it's very important to us that our doctors look like our patients. And we have always valued diversity. And in years past, especially during the pandemic and the tragedies that followed thereafter, socially, there has been a big call for increased diversity, which is great. However, if you look historically at Emory, this has been a priority of ours dating way back. This isn't just something we're saying, this is something we're doing and have been doing. And me personally, this is one of the things it's probably what I'm most proud of about the program is the diversity in our program that we've had. And, this is something that isn't an accident. This is something that we prioritize. Our program is almost 40% underrepresented minorities. And again, this is very important because we want our residents to look like our patients. And we also think it's important for us all as individuals to understand, the history of racism in medicine and why diversity is important. So this is something that's integrated into our didactics. A few things about the program specifically. We are I think I wrote it on this slide or maybe this one. We're an advanced program. So our program is technically a 3-year program, but we do have a guaranteed internship year for our residents if you want it. It's a transitional year, and it's mostly at Grady, which is I'll talk about it a little bit later. It's our safety net hospital. The transition year program, you do not have to interview. You can if you want to. If you want to learn more about the program and meet the program director, you can interview, but you don't have to. It's not required. The program director is Dr. Malik. He's really nice. He's awesome. He just took over the program last year. And this year, all of our residents are all interns in this program. But the year before, sometimes there's one person that just wants to do the year elsewhere for family reasons or whatever. And so that if you want to do the intern year here, you can. All you have to do is apply through ARIS, and we will give you that information. Tracy will give you the information on how to do that. And a lot of times there's always someone every year that forgets and kind of freaks out like, oh my gosh, I didn't apply. But don't worry, even if you apply late, it's going to be okay. You'll still be guaranteed your slot. It is a pretty traditional transition year. So you do mostly internal medicine wards, you do some ICU, there's elective time. It's really nice because there is that elective time, and most of the interns do spend time with us. They all do a required month with us on inpatient, but many of them do a month on epilepsy, which is really fun. I've worked with several of the interns because they have done some time on EEG and epilepsy. This is our intern class currently. They're really awesome. They're so cohesive. They're so fun. They already do tons of stuff together, and they're a great class, like all of our classes, but they're really awesome. A little bit about our hospitals. I think that this is one of the huge strengths of our program is that we have a lot of diversity in our hospitals. The experience you're going to get at the different hospitals is very different. So this is something that I encourage you to look for as you're interviewing. You don't want to just train at one hospital. You want to train at different hospitals to get different experiences and work with different patient populations. Our university hospital is really unique, I think, because it is right on the campus of Emory University. Most university hospitals are not right on campus. They're somewhere away from the college. But our hospital is literally right on campus. So you can go out the back door, the quad is there, the dining hall is right next door, the college students are around, the business school's right next door, the law school. And it's just really fun to feel like we're part of that Emory environment. The hospital is a tertiary care facility, so we get transfers from all over. We are a consult service. We don't have a primary ward service at Emory. We're a consult service staffed by neurohospitalists, which is great. Because you're not going to have, like a movement disorder researcher coming out of their lab to do their 2 weeks on service, and they're not really up to date on stroke and the newest recommendations for inpatient neurology. So we have full-time neurohospitalists that are on this service. The patients are super interesting. It's a really great experience. The residents love it. There's a lot of just interesting neuro ID cases, neuro-ophthalmology cases. We have some of the top neuro-ophthalmologists in the world here at Emory, so we do get a lot of those cases on inpatient. It's very interesting. Of course, we see, the typical bread and butter neurology like stroke, and, MS exacerbations, seizures, things like that. It's a great experience. There's also a neuro ICU that you'll rotate through, and that's one of the biggest subarachnoid centers in the country, and just lots of bread and butter neuro ICU, and there's amazing teaching there. It's really just wonderful. The patients at EUH, that's what we call Emory University Hospital, they tend to be more patients with insurance. And so it's a very different patient population than you'll work with at Grady Memorial Hospital, which is really the reason that a lot of people want to come train with us. Grady is a safety net hospital. It's a huge hospital in downtown Atlanta, 1,000 beds. And it's the largest, there's more stroke at Grady than any other hospital. There are more thrombectomies done there than any other hospital in the country. We're right in the middle of the stroke belt. So our residents really get excellent stroke training. I feel that they've pretty much done a stroke fellowship when they've finished their residency. It's just a wonderful experience there. I work at Grady, primarily at Grady. I used to do clinical work at Emory, but now I'm full-time at Grady. I love it. The patients are wonderful. They are, patients from underserved populations, a lot of minority patients, patients that are from other countries that just arrived, that don't speak English, that might have more pathology because they haven't had medical care, and patients that are homeless. So you really have an opportunity to do good and to help people. And it's just personally, I love working in this hospital, and I think it's just such a great experience and so important in your training to work in this type of setting. For those of you who are interested in working with underserved populations, you will love Grady. Again, like I said, it's a huge hospital, huge trauma center. That's the only trauma center in Atlanta. So we get a lot of trauma, a lot of stroke, obviously. We have 4 services at Grady. We have the ward, we have the neuro ICU, we have the consult service, and we have the stroke service. So like I said, there's a lot of thrombectomies done there. This is one of our chief residents rotating in the neuro IR suite. He is going to be doing a neuro IR fellowship. Actually, a lot of our residents go on to do neurointervention because they get such great exposure and great teaching here. One of the unique things is that our neuro IR suite is right in the neuro ICU, and that is unique to our hospital system. That's not seen anywhere else in the country. So there's a lot of unique things about this hospital. Some other hospitals that you'll get to rotate at are Children's Healthcare of Atlanta, or CHOA. It's right across the street from Emory, and you'll do your 3 months of peds there. It's a wonderful hospital. Our residents really like that experience. And the VA, the Atlanta VA, which is about a mile away. I personally really like working with veterans, and I worked at the VA for 3 years when I first started at Emory. It's a really great group of patients. They do have a lot of pathology, a lot of TBI. And so it's really interesting. You'll do mostly outpatient there. There's outpatient rotations that are done there. So a lot of subspecialty rotations. Subspecialty clinics are done there when you're on your outpatient rotation there. Other collaborating institutions we have the CDC, the Centers for Disease Control. So that is literally on the same street as Emory, right down the street. And if you're interested in epidemiology, public health, neuroinfectious disease, this is a great opportunity for collaboration. We also have Georgia Tech, for those of you who are engineers, right down the street in downtown Atlanta. And there is so much opportunity for collaboration with Georgia Tech. And so that's a great resource to have nearby. Let's talk a little bit about the curriculum. And again, I don't want to get too much in the weeds about this, but I do want you to know what you'd be doing if you came here, because I think it's really important to know, how much call am I going to have? How much inpatient am I going to have? And we have really worked to reduce the amount of inpatient time and to increase the amount of outpatient and subspecialty time, especially because you do have to pick your specialty, your subspecialty relatively early. So we do try to give our residents exposure to the subspecialties early on. I didn't mention earlier that we do have a child neurology residency here, and those PGY3s are integrated into our program. And when they are PGY3s, they spend the entire year with our PGY2s, and there are 4 of them. So that's nice because that's it's a larger pool of residents for call. And also they're just awesome. We bring them into our family, and they come to didactics every week. They come to all of our parties and get-togethers. They're really just part of our group. As a PGY2, you're going to spend 18 to 20 weeks on inpatient. You'll rotate through all of our services. I'll talk a little bit about the way call works shortly, but we do have a night float system at Emory. So you'll rotate through that 4 to 5 blocks. So that's 8 to 10 weeks of night float. And then you'll do a month of all the other services. So a month of Emory consults, Emory Neuro ICU, Grady wards, consults, and stroke. And the other rotations you'll do that are outpatient, you'll do time at the VA clinic, also a month of EEG interpretation, and then a couple of weeks each of movement, cognitive, and general neuro/MS. So I didn't mention that we do 2-week blocks. A month was just too long. Some of our inpatient rotations can get pretty busy. And so it's really important to me that our residents don't burn out. So one of the things we do is our residents never do more than 4 weeks of inpatient in a row. Our schedule is set up so there's a max of 4 weeks of inpatient and then 2 weeks of an outpatient or elective block. And that's really helped reduce it's helped just improve quality of life for the residents. Regarding call and nights, again, this is super important to me. I feel like my well-being is directly correlated to how much sleep I'm getting. And so, we've systematically, since I've been here, since I've been program director, tried to reduce the amount of call, the amount of nights that the residents have had. And so there have been many changes and continue to be more changes to do this. Because, it is important to work at night. Of course, we all have to do that, but there comes a point when it's just not educational because you've been up for too many hours and you're just tired and you're not learning. And so this is an educational experience. We're trying to give you the best experience, not work you so that you're burned out. So when you're on at Emory, so there's basically, let me back up for a second. There's 2 hospitals that we have to cover 24/7. One is Emory and one is Grady. And both of them have night float systems. Emory, the night float, is a PGY2. So that'll be you when you're in your first year of neurology. We do have 2 night floats at Emory, which is great because that means you have less shifts. Before I won't get into the way it was before, but before it was really rough. And there were some 24-hour calls in there, which was really hard. So now we have 2 night floats. Each of them do 5 shifts. One of them does 4 night shifts and 1 day shift, and one of them does 3. Hold on, let me remember how this works. One of them does 4 day shifts. I'm sorry, I'm so confused right now. The resident. This is, I don't know what the way I did this. Okay. Sorry. I understand now. This is the weeks. So this is the first week and the second week. And we're not doing it this way anymore. This is originally how we were going to do it. We were going to have one resident do 2 days, 1 week, 3 days, 1 week, and 4 days the next. But the way we do it is, one resident does 4 nights, and then the other resident does 3 nights and 1 day shift. So everyone does 4 shifts a week. Okay. So 4 shifts a week, which is much better than before, which was 5 shifts a week, plus a 24-hour call. And when you're on this call, you come in at 6:30 and get sign out. And then you stay until 7 a.m. the next morning. The attending comes in, you present your patients, and you leave by 8:30 at the latest. So you don't go see all the patients with the team. You go see one interesting patient with the team, and then you leave by 8:30. So it's 14 hours. When you're there, you're alone in the hospital. So you have to cover all of the ER consults, the epilepsy monitoring unit, any patients there that you might get called on, any transfers, stroke alerts, it's all you. And you're going to have a senior with you for the first 3 calls. And so you'll kind of get, learn the lay of the land and have backup. There is an attending obviously on to back you up the whole time. And so you just can call the attending if you have any questions. It's a really great experience because you're going to learn autonomy and you're going to learn how to manage stuff because you're there at night alone. You've got to figure stuff out. And it can be pretty busy. There are some nights when people get 10 consults, but there are some quieter nights too, when you might only get like 2 or 3. Grady also is covered by a night float system, but as a PGY2, you don't do that. That's done by the PGY3s. However, you help the night float. We want to kind of get you exposed to Grady nights because Grady nights can be pretty crazy. And so what we do is when you're on the ward at Grady, or when you're, if you're rotating in the neuro ICU at Grady, which some of the PGY2s do, you'll do 1 call a week. And so on the 2-week block, you'll do 1 call during the week and 1 call on the weekend. So like on an overnight on Saturday. If you're on during the week, you just do your regular rotation during the day. And then you, at night, like at 6, you'll meet up with the night float, help the night float. And then you have protected nap time from 2 to 7 a.m., which is really nice because you get to sleep. And so you're going to be refreshed the next day and you go home post call. If you're in the ICU, you leave at 7 a.m. sharp. You sign out to the nurse practitioner and you leave at 7 a.m. sharp. The reason we do this is because in the past, I found out that some of the neuro ICU attendings weren't rounding until like 10. And so the residents were leaving late and I didn't want that to happen. And so now we say 7 a.m. sharp, the resident leaves after they sign out. If you're on the ward, you also do the calls once a week. However, it's the same. You help the night float at night, you get your protected nap, but you stay till after rounds. And that's because you are going to leave on time because it's our team. So we make sure that that post-call resident leaves. So overall, how much is this? How much call? Well, you're only going to be doing 4 to 6 weeks of these rotations. And so that's just a total of, 1 call a week when you're on for those 4 to 6 weeks. So that's 4 to 6 overnight calls. So overall, overnight calls only taken on 14 to 16 weeks of the year. There are also some weekend day shifts at Emory that you have to do. You have to do a total of 4 Sundays in the whole year because there's no one to cover those Sunday day shifts. So 7 a.m. to 6:30 p.m. Everyone does 4 of those while you're on elective or while you're on an outpatient rotation. As a PGY3, you're going to do a total of 8 to 9 blocks of inpatient. Most of that is Grady consults. And this is when you're going to start getting your autonomy. You're running a team. It's kind of crazy at first, but it's a really great experience. Grady consults is I actually did some time on Grady consults as an attending when I first started working at Grady. And I was looking to step up every day because I was seeing things I'd never seen before. It was amazing. It's just such a great educational experience. You will see the most interesting pathology, the most diverse pathology, the most interesting patients. It's such a great experience. The residents love it. And for good reason, because you learn so much. You'll also spend time on Grady Night Float, and also you'll be the senior on Emory consults. And so those are the 3 inpatient services. You will also do some pediatrics, some inpatient pediatrics when you're doing your 3 months of peds. You will also spend time doing neuro-ophthalmology. Like I mentioned, we have a very robust neuro-ophthalmology department here, and you'll spend a little bit of time in epilepsy clinic and do some EMGs. You'll have quite a bit of elective time as well to pursue your own individual interests. call schedule as a PGY3. So the night float is 5 shifts a week. You come in at 6 and you leave at 7 a.m. sharp. And otherwise, so that's Sunday to Thursday. And then the Friday, Saturday, and Sunday day are divided up between the rest of the PGY3s and the PGY4s that are on elective or outpatient rotations. And so we used to have 24-hour calls for them to divide up, but those were just insane, so busy. And Grady, you can get, 10, 15 consults in 12 hours and then having to do 24 hours when they're getting like 20 consults. It was just way too much. So that was another change that was made. We divided it up into these half of a day instead of the full 24 hours, 12-hour shifts. And so there's someone does both nights or someone does both days, and everyone does 7 of those while they're on elective or outpatient rotations, and it works out so much better. Residents are so much happier with that change, and that change was made about 2 years ago. As a PGY4, there's a lot more outpatient and elective time, 14 weeks or 14 blocks. I'm sorry, that's 28 weeks. Everyone does a required month of psychiatry, and the rest of the time you'll spend as the senior on the Grady ward and on Emory consults. As a PGY4, there's barely any call. You just do weekend. You do have to come in on the weekends if you're on Grady. If you're on the Grady ward team, you have to come in on either Saturday or Sunday to round. But if you come on the Sunday, it's nice because you get paid. You get paid moonlighting money for that. You'll also have to come in to work those weekend shifts at Grady, those Friday, Saturday night, or the Saturday, Sunday day, but that's only a total of 3 to 4 shifts per year. Finally, I want to talk to you about the benefits here. And this is really important. This is something I didn't really think about when I was interviewing. But one of the great benefits is the vacation time. Our residents get 2-week blocks of vacation. So that'll allow you to really travel somewhere. Our residents will, we've had some very adventurous residents who love to travel, and they would just see where they could get a cheap ticket. And then they'd go off to these like really cool places, South Africa, Slovenia, Peru, just going all over the place. And so those 2-week blocks are really nice. Also, they get a bonus week off at the holidays called Home for the Holidays. So in, end of December, beginning of January, there's 2 weeks that we call Home for the Holidays. Everyone works for 1 week and then they have 1 week off. And the residents love that because then they can go home and see their families or just travel. And that's great. Other benefits, we have a 401k match. I was a total financial idiot when I was a resident. I knew nothing about retirement or saving or anything. And so I wish I would have known. It's really nice here that we do have a 401k match. And I, talk to the residents about this at orientation and really remind them that it's important to start investing for retirement early. We have sick leave as well. We have paid parental leave, which is great. Everyone gets 6 weeks of paid parental leave, and we're a very family-friendly program. We just had a baby born in the program last week to one of our PGY2s. We have we have 3 other residents who are either pregnant or their partner is pregnant. And we have had tons of babies born. We're a very family-friendly department. So, and the great thing is now you can still graduate on time, even if you have a baby when you're a resident. So that's awesome. We do have emergency childcare, and there's a daycare at Emory for those of you who do have kids. It's a great daycare. My daughter went there. A lot of faculty and residents' kids go there. There are moonlighting opportunities here for those of you who are interested in making money, which I would have loved because, like I said, I was broke and not financially savvy when I was a resident. So that's a great opportunity. You can do extra shifts at Emory, at Grady, even at the VA to make extra money. So that's great. I also didn't mention that we have wellness days. So every resident gets 8 days a year that they can just take off during the week. So if you need to take a day to just, it's just like a mental health day. You can do whatever you want. So you schedule those ahead of time and you get those 8 days a year, which is great. Like I said, wellness is super important to me. And that was one of the changes we made a few years ago to improve resident wellness.
Hi, everyone. I'm Spencer Hutto, the Assistant Program Director of the Adult Neurology Residency Program here at Emory. I'm an autoimmune neurologist by training, and I practice as a neurohospitalist at Emory University Hospital, where I spend all of my clinical working hours with residents. I've been at Emory for the last 7 years. I started as an intern at Grady Memorial Hospital. I spent the next 3 years as a neurology resident at Emory University Hospital, Grady Memorial Hospital, and Brain Health Center. And I followed that with 1 year fellowship in clinical neurophysiology before going on to doing my autoimmune neurology fellowship at Mass General Hospital. I'd just like to start by saying it's really great having you all here. Thank you so much for choosing to interview at Emory. We're very happy that you're here, and I want to welcome you to this very warm community of Emory neurology faculty and trainees. One thing I'd like to emphasize is that this is the sort of place where there are plenty of opportunities to figure out what type of neurologist you're truly meant to be. You don't have to have it all figured out as soon as you get here. I know I sure didn't. I never thought I would live really in a major city, be a professor, or get involved in research, and yet here I am. When you get here, you'll be connected to the right people who will invest in you and your future at all levels. Many of the people I met at Emory have had major influences on my own career, including Drs. Matthews and Kahn. I really hope that you all enjoy the rest of your day here. And if you have any follow-up questions to some of the things that we talk about today that I can answer, please don't hesitate to send those to me.
So I'd like to begin just by talking about didactics. So didactics takes place for us every Friday. We spend 3 hours, all of our residents together at the Brain Health Center from 11 a.m. To 2 p.m. All of our residents come together from the various sites. We feel like this is important to have all of our residents together in person. It's a chance for them all to kind of reconnect, from having been, separated at the various sites throughout the week, foster camaraderie, and just, to build cohesion. And so our curriculum for didactics is a 2-year curriculum. We divide it up into blocks. So generally speaking, residents are kind of in blocks as they kind of progress through their learning and didactics. So they might have, a month that they're learning about neuroimmunology, another month for neurointensive care, another month for vascular neurology, and so forth. As time kind of, marches on throughout the year. All of our residents hear the talks at least once, if not twice. We do have longitudinal courses scattered throughout the year for topics that we feel can benefit from repetition and kind of regular discussion. So those things including, learning how to read EEGs and interpret EMGs. We have localization rounds about every 4 to 6 weeks. And we discuss journal club, usually in the standard didactics format. We have a research series and also a DEI curriculum. We do talk about other topics that are not necessarily the medical side of medicine. And so some of those things included would be ethics, business of medicine, billing and coding. We have some pictures of our residents in didactics in the top right. And also we do occasionally host journal club outside of the sort of formal didactic setting. And so this is a picture of some of our residents and attendings at a local restaurant discussing some of the stroke literature. We do have weekly educational conferences scattered throughout the week, and the residency program actually hosts 2 of those. And so those are the ambulatory noon conference and also CASE conference, which is in honor of Dr. Carlos Case, one of our esteemed professors who's really well known for his exemplary teaching. So the ambulatory noon conference focuses mainly on issues germane to outpatient neurology. This is an important time to kind of stop and seriously consider the things that you need to know as an outpatient neurologist, and also, a nice break from the inpatient side of neurology. CASE conference is devoted to interesting learning cases from the inpatient setting. And so our residents, select cases that are interesting from Grady consults, from Grady wards, and also Emory University Hospital consults. And we broadcast that through Zoom to all residents at all sites to participate in a detailed discussion of the case, the localization, that then follows with additional learning points. At Emory, we do benefit tremendously from a very rich fellowship programs, and those fellowship programs host their own weekly educational conferences. And so some examples of those are listed here. All of our residents can attend if they're able and interested. And we have a wide offering of weekly educational conferences. And so epilepsy surgery is a favorite conference. We have a movement video conference for interesting discussions amongst attendings to identify, the semiology of certain movements or the phenomenology. We have neuroimmunology, neuromuscular every Friday, and then a regular stroke conference as well, in addition to some of the other ones that you see here. In preparation for the transition from intern year to the first year of neurology as a PGY2, we do offer a neurology boot camp for those transitioning residents. That is a time to kind of like return to the basics and focus on the things that will be sort of the fundamentals that will be incredibly important in the first few weeks and months of being a neurology PGY2. And so we review the neurologic exam with our senior residents, coaching our rising junior residents. We host training on performing lumbar punctures, which will be sort of a regular procedure that our inpatient residents perform. We have a course on neurologic emergencies and urgencies. And so, in this time, we spend a lot of time talking about, routine neurologic emergencies that we expect our residents to see within their first few days of, say, night float or consults. And so those things cover the basics of acute ischemic stroke, intracranial hemorrhage, neuromuscular respiratory failure, among other things. This year, we've added simulations to our neurology bootcamp because we feel that it's sometimes important to not just talk about things conceptually, but to give the residents a chance to act it out and to have sort of a simulated walkthrough of a typical neurologic emergency under the supervision of attendings and senior residents. And so what we've covered this year is on ischemic stroke, intracranial hemorrhage, status epilepticus, and intracranial hypertension. We have a phenomenal simulation center here at the Emory School of Medicine. And so we're very fortunate to be able to host these simulations there. And so what you see in the top right are residents kind of assessing a patient, dealing with intracranial hypertension. And in the bottom right, our residents are assessing a patient who is experiencing a seizure post-op. As you all have probably begun to notice, mentorship is an incredibly important and critical component of your careers going forward. And it's so important to have someone who can kind of guide you through that process along a number of different facets. And so at Emory, we offer our residents multiple opportunities for mentorship. And those generally can happen in 2 to 3 different ways, depending on the career plan of the resident and their interest. And so we offer both mentoring in an individualized setting and also through our house system. So the individualized mentoring is something that we encourage for all the residents to have a formal mentor, at the very least, just to kind of discuss their future career plans and how that intersects with their life, and how to kind of create a successful and sustainable work-life balance. For residents who are interested in research, there's mentoring for research on projects as simple as a retrospective chart review to something as complex as acquiring a T32 educational grant. We do have mentoring in a group setting in what we call our house system additionally. So we divide all of our residents into 4 houses named for famous neurologists that you see here. And residents have the chance to just, spend time in a more relaxed setting with their co-residents. And so, they get mentoring across the spectrum, really, of neurology. So from their co-residents, same year as them, sometimes from senior residents. And our houses are led by some of our distinguished faculty who guide these houses, throughout the year. The house system is more really though than just mentoring, and so we use it as an opportunity for residents to get together and spend some time, kind of outside of work, again in a more relaxed setting. We do also encourage some competition between the houses, and so as you can see here in the top right, this is a picture of our brain cup. And the house at the end of the year that accumulates the most points for teaching, for scholarship, and for excellent clinical care win the brain cup at the end of the year. And so the houses are given points for sort of exemplary performance in one of those areas. And it's always quite a competition to see who will win at the end of the year. Each house, or the winning house for each year, has a plaque sort of inscribed with their names and the year that they won at the base of this Emory Brain Cup. Research is not required actually at Emory, but there are a multitude of opportunities for research by residents here. And so I just wanted to cover some of those briefly, but there are opportunities for residents to participate in research really across the spectrum. So there are opportunities for those who are interested in basic science, for translational research, and also, and especially clinical research. Residents who know early on in their career that they have a major interest in pursuing research as a career, as a clinician scientist, can become involved in our neurology resident research track. So that is a time where residents have regular meetings with some of our clinician scientists to kind of learn the ins and outs of what it takes to be a successful researcher in academic neurology. Our residents receive departmental support to present at conferences. And so, as you can kind of see demonstrated in our photos here, we have had the fortune of having numerous residents participate at many conferences in the last year. And so kind of what we have pictured here are sort of a smattering of presentations at the American Academy of Neurology Summer Conference on autoimmune neurology, Presley in the bottom right, discussing sarcoid pocky meningitis. Eleanor Thomas in the bottom left is presenting her work on COVID-19 outcomes in patients with myasthenia gravis, for which she won the Goldseth Award at the American Academy of Electrodiagnostic and Neuromuscular Medicine. Mahmoud is presenting some of his stroke research in the top right at the Society of Vascular and Interventional Neurology. And Chineze is also presenting a paper on sarcoid myositis at A&M. And so Sitara in the middle left is presenting some of her stroke research at SVIN, as is Ahiz Lay in the middle right to the crowd there. And so one of the things that we really want to press upon people is that if this is something that interests you in particular, Emory is a great place to pursue your research and also to receive the support and the mentoring that you need to be successful in research. I will just say quickly that there will be more talks later to come about some of the nuts and bolts of research at Emory. And so the topic of the neurology resident research track will be discussed at greater detail with some of our clinician scientists in a later session. Our residents are regularly involved in the American Academy of Neurology. We do encourage that. And in the past year, we've had several residents involved at a number of different levels with the Academy. And so Joaquin Vizcarra, who's one of our chief residents, is currently one of the editorial team members for the Green Journal's resident and fellow section. One of our former residents, Eric Lawson, who's a neurocritical care fellow here at Emory, participated in the Enhanced Resident Leadership Program. Sitara Caneru is participating in the Futures in Neurologic Research Scholarship. And then Christy Suarez, who's pictured here on the right, participated as a panelist at the annual meeting in 2022, discussing perspectives of URM neurologists. We do offer residency tracks outside of research at Emory, and those are primarily hosted by graduate medical education here. And so, you may not be the person who's particularly interested in research, but you may not have an interest in teaching. How do you develop yourself as an educator? There's a track for that here at Emory, the medical education track. Maybe you want to expand your audience for whatever your particular skill is. So we have a residency track called Globe that focuses on the global practice of medicine. And so if you have an interest in global neurology, maybe that's something to think about. Maybe you want to extend your skills from a health equity perspective. And so we have the HEAP track. But as you can see here, there are a number of different tracks offered through the School of Medicine that residents can engage in. And I would encourage you, if you're interested or you want to learn more about this, the link at the bottom of this slide will take you to the specifics of each track and sort of how long the tracks are. Generally speaking, they're 1 to 2 years in duration. All of our residents are eligible, for each track, and so they can apply to those and join those residency tracks alongside the rest of their residency training. And the last few slides we just want to devote to wellness, and some of the social opportunities that you'll have here at Emory. So, one of the really one of the strengths of the program actually is the family of Emory, and the residency program, and how close our residents are, with one another and also with faculty. And so, just want to emphasize that that Emory is the type of place where you'll have an opportunity to grow close to your co-residents, and also your attendings. We think this is an important part of training. Residency training is tough, and it is so critical to be surrounded by those who are there to support you and see you succeed. And we have a lot of things in place to encourage this here at Emory. And so this first slide kind of highlights some of the social activities that have come out of the house system. And so in the bottom left, you'll see obviously that this is a pumpkin carving contest. In Atlanta, at least, Halloween is a very celebrated holiday. People get very invested in decorating for Halloween and just taking it, really to the ninth degree. And in the Emory Neurology Residency Program, we are no different. And then in the bottom right, this house led by Dr. Garcia is out participating in community gardening. And so our house systems will at times host various events, for their houses, and kind of get them out of the clinic, out of the hospital, for get-togethers amongst the various members. We do things also outside of the house system, and so Dr. Matthews frequently hosts events at her house actually, and so that's what we see to the left here. Our interns this year on the right met up at Ahisale's apartment to get to know one another before entering their first days of intern year, and so you'll see that there. And then those are just additional pictures of some of the events that Dr. Matthews has hosted, and so you see that on the left and also in the bottom right here. We do host outside of the house system. We have residency-wide events, and so you can kind of see us celebrating Satara's birthday in the bottom left, and then having all of the residents meet up at Piedmont Park in the bottom right. And so in Atlanta, it is known as the city in the forest, and we have a host of parks kind of scattered throughout the city. We're very lucky to have good weather here in Atlanta. And this is just a photo of our residents getting together at Atlanta's most celebrated park, Piedmont Park near Midtown. Our residents do get together annually for a retreat, and so we do think that it's really important for our residents to have at least one day to spend together, away from the distractions of their clinical obligations, to just kind of get to know each other better, build some camaraderie, and do some team building activities, as you can kind of see in the bottom right. So we host this every year, generally speaking, in the first part of the year, and the goal is to get the residents kind of away from the training environment, just to spend amongst themselves.
So overall, I think there's so many things that make Emory special. But the main reasons that I think Emory is a special place are, the diversity that you're going to see here, not only among the residents, the faculty. We're all from such different backgrounds, but we all get along really well and we learn from each other. You're going to have amazing diversity in the patients that you see, the pathology, and at different hospitals. You're going to train at a university hospital, at an inner city safety net hospital, and a VA hospital. And I think that that's so important in your training. There's such great opportunities here, no matter what you're interested in, or if you don't know what you're interested in, you're going to get exposed to everything here so you can figure out what you want to do. If you're interested in research, we're a world-class research institution. If you're interested in teaching, you can do the clinical educator track. If you're interested in business, there's the healthcare administration track. If you're interested in no matter what you're interested in, there's something here for you. The environment here is such a supportive environment. We're not a malignant program. Our faculty are so nice. Everyone here is very supportive. And, I have to say, it's not all perfect. I would be lying if I said, oh, everyone's so nice and wonderful. There have been issues, with faculty, certain people in the past, but the residents know that they can come to me if there's an issue and that I will take care of it, and that I do not tolerate anyone that's disrespectful or unprofessional to my residents. And in the past, when that's happened, I have removed those faculty members from working with the residents. And so that's the kind of environment that we have. I protect the residents. I want them to have a great learning experience. And that really comes from above. That is the culture of our program here. That kind of behavior is not tolerated. And again, that comes from above. It comes from, my chair, who does not tolerate unprofessional behavior. And so that, respect for each other really trickles down. The people here are just so special. It's just such a great place. And you'll see that people come to Emory and they stay at Emory, and that's for a reason, because it is such a great environment. So all in all, I really hope that you consider us, and I would love to see you all here next year. And I really look forward to speaking to each and every one of you.